I have the best job in the world right now, as far as I'm concerned, because I believe so much, because I see it every day in the power of helping people take charge of their own health.
If it wasn't for this program, I don't know where my life would be. I see where I'm at now, being able to do activities I haven't done in years. I am so grateful to lifestyle medicine because it has really saved my life.
When I practiced primary care, I felt like I tried to do a great job talking to my patients about their health habits. And yet, both my patients and myself were frustrated over and over again when nothing really had changed. And in fact, oftentimes things would get worse with their chronic conditions. I got a great opportunity at St. Luke's Health System, and when I walked in the door to interview for that position, I just knew that this is really where my life was going to go, because what I witnessed was team-based care, and that these patients were actually improving their quality of life and their function. I really got excited at the possibilities that this is really the way healthcare should go, and we should find a way to make that work for patients and for healthcare systems.
I got involved in lifestyle medicine about 8 years ago when we weren't even kind of thinking or using the terminology of lifestyle medicine. Having that multidisciplinary team really allows all of those specialists to focus in on their specific pillar. I'm not an expert in behavioral health. I'm not an expert in sleep or diet, and that's where we really rely on our dietitians, our social workers, our clinical psychologists to bring that expertise to the table so we're treating that whole person.
St. Luke's had the vision that they would be moving into more of a value-based care model. So when the opportunity presented itself with the Treasure Valley YMCA reaching out for a healthcare partner, St. Luke's raised their hand and came back to myself and my partners in our department and said, we'd really like you to design and build a clinic that offers health habit improvement programming.
What brought me initially to St. Luke's was my health had deteriorated a lot. I had diabetes, also cirrhosis of the liver. On top of that, I also had chronic fatigue, and it made a big difference coming to lifestyle medicine and being able to have not just one person, but an entire staff that was there to help me through, no matter what it was. At first, it was a little, intimidating for me because I didn't know what to expect.
At some point, it became obvious to her that she needed to jump way into the water.
With the plant-based diet, it allowed me to reduce my medications. It has a direct result on the chronic fatigue. And it took me a while to understand that. It took me a while to understand the stress that my body was under.
She started to address her sleep issues, and her energy started to improve. And all of a sudden, this sort of fed into this cycle of virtue that helped her become more confident, and she really has made remarkable improvements. In fact, she started to thrive.
I'll never forget Dr. Shaw's called me after I'd had blood work done, and she said, "Your results are normal." And I just started bawling because I was so excited and so happy and so grateful. If it wasn't for lifestyle medicine, that would have never happened.
It's hard. It's not easy. If it was easy, everyone would do it. But, sometimes those hard things are the right things to do. And that's going to be kind of the wave of the future, is that the more and more payers are going to be covering kind of these non-traditional lifestyle medicine services. And then hopefully in the future, we can drop that non-traditional, and these are just going to be traditional services that every single patient expects to have as part of their benefits.
When you can teach people how to take better care of themselves and overcome barriers to making sustainable health habit change, and they start reaping the benefits and start feeling better and start becoming more confident and building self-esteem, and then they're influencing their other family members and their neighbors, you are throwing a little rock in the pond here and having this incredible ripple effect on people's lives.
Lifestyle medicine is an evidence-based approach to prevent, treat, and reverse disease by replacing unhealthy behaviors with healthy ones. You might be asking yourself how lifestyle medicine is different than conventional medicine. Well, lifestyle medicine differs from conventional medicine in three key ways. First, you as a patient are an active partner in your treatment plan. Instead of us telling you what to do, we'll work together with you on your journey towards improved health. Second, instead of only focusing on symptom management, we seek the root cause for illness and try to correct it at that level. What are each of us doing repetitively or exposing ourselves to that could be causing our illness? This leads to the third difference. Medicines that we focus on here are often changes to lifestyle habits. Improving our lifestyle is medicine. A few questions to reflect on. Do you ever feel like you are not living to your fullest health? Do you ever recognize that there's a connection between the way that you are living and the symptoms you experience? Do you ever feel like you are ready for a change, that you want to live differently and feel differently? If you answered yes to any of these questions, then lifestyle medicine is right for you. As you go through this information, I encourage you to consider a few things. Why is joining this program important to you? And what do you hope to achieve for your health and wellness by taking part in lifestyle medicine? Our lifestyle, the decisions we make on a day-to-day basis, plays a big role in our health. According to the World Health Organization, 80% of chronic illness could be prevented if 4 key lifestyle practices were followed. Having a healthy diet, being physically active, avoiding tobacco, and use of alcohol in moderation. If you question the World Health Organization's assertion, look at this graphic from the American Hospital Association. They did a study looking at, on average, what affects American adults' health. At 7%, our physical environment. This includes factors like air quality, water quality. The next piece, at 11%, is disappointing, being employed in healthcare. Health and medical care is only 11% effect on our health. Think of all of the resources that we put into medical care. At 22%, genetics is no surprise, and it's true that we cannot change the genes given by our parents, but there are very few diseases that we inherit at birth. Given our genes, we can be more predisposed to developing disease, but if we make healthier decisions, it reduces the chance we'll develop disease. And for those that already have chronic disease, if you improved your lifestyle decisions, your situation, your symptoms would likely improve. Social circumstances is nearly a quarter of the pie, and social circumstances includes a lot of things: our work and our home environments, having a safe place to live, access to transportation, access to healthy food, the amount of stress that we have, including being in a culture where we feel valued, and the ability to love and relate to others. All of these are in this piece, and they can either positively or negatively affect our health. The largest piece of the pie at 36% is behaviors, our choices that we make on a day-to-day basis. And I would even challenge you to think about this as an hour-to-hour basis, have the biggest effect on our health. And these behaviors compound over time, whether that be in a positive or in a negative direction for our health. So how do we move forward? There are 6 pillars of lifestyle medicine, and I want you to think of this as the foundation that we stand on for good health. The power of lifestyle medicine really lies in the combination of all pillars. So let's take a moment to look at each one. So let's start with what we consume. Healthful eating is about finding a nutrition plan that you can sustain for life, not a diet that you do in the short term but cannot maintain. You can see here that whole plant-based food is included in this pillar, where people are living the longest without chronic disease, living functional and engaging lives. These are people who eat all to mostly plants. This is food that's rich in fiber and nutrient dense and includes vegetables, fruits, beans, lentils, whole grains, nuts, and seeds. While we often think of pills as medicine, if we consume healthy, nutrient-dense food, we optimize our body's ability to heal. In this sense, food is literally medicine. We have dietitians to help you find foods that support your body, can teach you kitchen tips to prepare them, in directing you and finding recipes for you to try. Second pillar of lifestyle medicine is increasing activity. Now, we all know that activity is good for us, and the goal is to be active every day. But this does not mean that everyone has to have a robust gym program. It's about finding activity that gives you joy or gives you the capability of doing things you enjoy. This could be gardening. It could be exercising to work towards a goal, such as being able to be more active and see more while you're on vacation, or even completing an event such as a 5K. That's how we want to view exercise. What can we do on a regular basis to be more active? We have exercise physiologists here to support you in finding your way and adding more movement into strengthening your body. Stress is a normal, healthy part of life. It can lead to improved health and productivity, or if we have too much and it's not managed well, it can lead to a host of negative effects, such as negatively affecting our mood, increasing our chance of being obese, reducing our immune function, and more. Therefore, developing strategies to manage stress is an important step in improving our health. Here at Lifestyle Medicine, our clinical social workers will teach you to recognize negative stress responses and teach you strategies to cope when feeling stressed. Forming and maintaining relationships is an important part of health. Positive relationships affect us emotionally, mentally, and physically. Leveraging the power of relationships and social networks can also help us reinforce healthy behaviors. Our clinical social workers have put together tools to help you to improve relationships with those around you. Lack of or poor quality sleep can lead to a strained immune system and cause other negative health effects, including difficulty in weight loss. Good sleep is an important part of good health. Our program includes identifying dietary, environmental, and coping behaviors to improve sleep. There's also treatment available that directly addresses insomnia if sleep has been a struggle for a long time. And finally, avoiding risky substances that increase the risk of chronic diseases and death is an important part of pursuing better health. Use of tobacco and excessive alcohol consumption are common areas where people struggle. Patients and support are an important part of breaking risky substance habits. We have nicotine dependence specialists in counseling to help you reduce or stop tobacco and alcohol use. St. Luke's Lifestyle Medicine Program is a medically supervised program that provides education and behavior change assistance in all pillars for lifestyle: exercise, nutrition, stress management and improving relationships, healthy sleep, and nicotine dependence treatment. Lifestyle medicine takes a team approach with experts representing all the pillars of lifestyle medicine. Your medical team includes a lifestyle medicine board certified physician and advanced practice providers, registered nursing staff, certified medical assistants, and pharmacy support. In nutrition, we have registered dietitians with specialties in plant-based nutrition, as well as diabetic care and chronic kidney disease. In exercise, we have certified exercise physiologists and a certified athletic trainer. In the emotional wellness area, we have licensed clinical social workers helping us on improving our stress, improving our relationships, and our sleep. To reduce the use of risky substances, we have a nicotine dependence treatment specialists. In the area of behavior change, we have board-certified health and well-being coaches. To provide assistance in our program, in addition to our medical assistant, we have patient business associates available at our front desk and for phone calls to help your experience run smoothly during your time in the lifestyle medicine program. There are several components to the lifestyle medicine program at St. Luke's. Our physician and advanced practice providers help manage your health and medical care as you make sustainable change. Group health coaching provides support and strategies for change, and our education classes help you learn more to improve your health. Exercise consults and programming help get you moving. Phase 2 offers continued support and accountability. St. Luke's Lifestyle Medicine program is supervised by board-certified lifestyle medicine physician and advanced practice providers. They will be in touch with your other physicians and advanced practice providers to help you make decisions about your health. Often, people will see drastic changes to their health as they make changes to their habits. To start our program, you will start with the initial visit. This appointment consists of 2 parts: a shared education session with a social worker, medical assistant, and physician or advanced practice providers that will build on this information. You will then have a one-on-one opportunity to meet with them to really see how using lifestyle could work for you to improve your health. Once in the program, you will have 3 more medical visits. 2 of these will occur during your health coach group. At these visits, you will have individual time with the physician or advanced practice provider to discuss your individual health concerns without the group. No one is ever asked to share personal medical information in a group setting. After your group finishes, you will again meet individually with the physician or advanced practice provider. Your health coach group is where you implement what you're learning into your life. You set the direction you want to go. You set the pace to get there by setting goals and action plans. In health coaching, you also learn strategies so the changes you will make will be sustainable for the long term. This is done with the group, so you learn from others as well as your health coach. There are 9 health coach sessions, 2 which include the medical follow-up, where you will have that individual breakout time with the physician or advanced practice provider. There are many opportunities for these groups, ranging from as early as 7:30 in the morning to as late as 5:30 in the evening. These groups meet every other week for a total of 9 sessions, skipping 5 major holidays. Working in health coaching within a group also provides you with a community, connecting with others who are also moving in the direction of improving their lives. There are education classes to help you build knowledge around all of the pillars of lifestyle medicine. There are classes on emotional wellness, which include stress reduction, sleep, and social relationships. Classes on plant-based nutrition, and tips to become more kitchen savvy. There's also a class on habit change, as so many of our decisions are based on our existing habits. These classes conveniently rotate through the same day and time of your choosing. There are options in the morning, at noon, and in the evening. Scheduled weekly, these classes rotate through. So if you have to miss one, you can either schedule into a different class time or wait 8 weeks for the class to come around again. Exercise options include our Active Living series that takes place virtually to develop your exercise program, or supervised exercise in planning in person, where you will talk to an exercise physiologist to determine a good workout plan for you. Throughout your time with lifestyle medicine is access to our mobile app with tools to track actions and goals, access to our open gym, in connection to our online community, so you can continue to connect and share with like-minded people working to live more vibrant and healthy lives. In addition to the classes that rotate weekly, there are classes and class series for you to explore that go deeper into other areas of lifestyle medicine. This is included in our post-program support that follows the initial program and includes up to a year of health coaching as you implement change, and continued access to those supplemental classes to build on knowledge you've already learned in this first phase. Our physical location is in the South Meridian YMCA. For those of you not real familiar with this location, the nearest large intersection is at Eagle and Amity Road. But many of you may not live near or have the ability to travel here, and know that that's okay. We have patients that go through this program that don't ever make it to our facility. The primary reason you'd be coming here would be if you choose to come in for exercise visits or are using our open gym. There is limited opportunity also to be seen for individual visits in person, if that's important to you. But coming to the YMCA is not a requirement of signing up for this program, and we have people in our program from all around the state of Idaho. In brief, the Lifestyle Medicine program bills individual insurance for our services. To find out how much you'll need to pay, you'll have to check with your insurance carrier. For help determining your copayment, we have included codes that we use in the Lifestyle Medicine billing document attached under this video. Insurance can be confusing, and most plans have what's called a deductible. You may pay more than your copay until your deductible is met. Insurance typically rolls or resets on an annual basis, but this doesn't happen the same for all insurance plans. For some, it may be January, it may be June, or even April. So if you don't know, this is another good question when you call the insurance company. St. Luke's does accept payment from family savings accounts and health savings accounts. If cost is a concern, please reach out to our clinic to schedule a 15-minute phone call with one of our social workers to discuss financial support options. Medical visits, education classes, and health coach sessions are all billed to insurance. There are 4 medical visits during phase 1 of our program, 8 education classes that rotate weekly, and 9 group health coach sessions that occur every other week. We encourage everyone to consider participation in our supplemental classes and class series after completing the initial education. These classes and class series go deeper into topics that may interest you. There are also opportunities to work individually with a counselor or meet individually with a dietitian. Note that these visits are also billed to insurance. If you are interested in learning more or in getting started, the next step is to schedule your initial appointment. Reminder, this includes 2 parts. First, the detailed virtual education session with the social worker, physician, or advanced practice provider and medical assistant. And following that, the second part, the individual meeting with the physician or advanced practice provider that can either be scheduled virtually or in person. To schedule this appointment, or if you have further questions about the Lifestyle Medicine program, phone us at 208-706-9710. Note that we are open Monday through Thursday from 8 to 5. Before coming in, we encourage you to consider a few questions. How would your life be different if you were living your best life possible? What is your why for wanting to make change? And what makes living life as your best self important to you? Remember, at Lifestyle Medicine, you are an active partner in making decisions about your health. We look forward to getting started with you soon.